98% of all arthritis is a simple mineral deficiency disease. Only 2% of arthritis is rheumatoid arthritis caused by an infection that's curable in 2 weeks. You can cure rheumatoid arthritis in 2 weeks with antibiotics. We've known that for 70 years. But see, there's no law requiring doctors to cure you, so how do they treat you? Let's see here. They give you prednisone, cortisone, they give you methotrexate, they give you gold shots, they do joint replacements, $750,000. Why should they take $300 in office calls? See, now you've become very dangerous now because now you know the truth. 85% of the people with rheumatoid arthritis also have bone-to-bone arthritis. So you still, even with rheumatoid arthritis, even though it's an infection, when it's advanced and all gnarled up, even people like that, within a year, we can get them playing concert piano. We've done it hundreds of times. You know, they're all gnarled up. No surgeries, no joint, just within a year, they repair. It's an amazing thing, okay? You give them the healthy bone and joint pack, you throw in what we call the killer biotic, kind of like Geraldine's boyfriend, Killer. Some of you may recognize this fellow, Andy Young, from the old civil rights movement. This is 1991. I was a little porkier back then. Shed about 60 pounds since then. But Andy was scheduled to get a double knee replacement because he had bone-to-bone arthritis, 1991. Athletes told him about me, so he called me and said, "Can you help me?" I said, "Yeah," and he canceled his double knee replacement surgeries. And that was 21 years ago. He's never had to have any joint surgery, and he's perfectly healthy now in his 80s. He can outrun an 18-year-old and swims 5 miles a day. He's been on my program for 21 years. The coming epidemic of arthritis. Why is there a coming epidemic of arthritis? That's because there's 80 million baby boomers all who listen to the doctors. Exercise is good for you. Drink plenty of water. Do not take any vitamins, minerals. You can overdose. Now, do you think they did that just because they were stupid? Or because they were protecting their trophy wife's lifestyle? This came out in September 2012. Soaring knee surgeries put a strain on costs. Why is that? Because there's 80 million baby boomers come along. And they all want knee surgeries because the doctors and insurance pay for it. Why would I want to pay $4 a day to rebuild my knee when insurance pays for surgery? Because when you do surgery on your right knee, what does that do for the other 71 joints in your body? Nothing! You take the healthy bone and joint pack, it supports and promotes maintenance and repair of all of them. Well, I better ask my doctor. I get that a lot. I better ask my doctor. You better hurry. He's 75 years and 11 and a half months old. He's only got 2 weeks left. Do not take those drugs, bisphosphates, Fosamax, and Boniva. They only reduce the rate of loss of brittle old bone. They do not build new bone, as doctors told you. That's why it's now 1-800-BAD-DRUG. Harvard Medical School, New England Journal of Medicine, 10 years ago, 2002. New England Journal of Medicine, they did a meta-study on 300,000 people that had joint replacement surgeries, knees, hips, shoulders. The reporters just use knee surgery because everybody knows about knee surgery. Knee surgery, AKA all joint surgeries for arthritis, are worthless. That's Harvard Medical School and the New England Journal of Medicine 10 years ago. But you go to any orthopedic surgeon, you say, "Oh, I've got bone-to-bone arthritis, both knees, and all these other doctors want to do joint replacements." Well, I'll do a better job and give you a 10% discount. Do any of them say, "Hey, let's try the healthy bone and joint pack for 90 days here? Then we'll decide about surgery"? No, 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 no. So what I want you to do is give Youngevity, give me 90 days. Do the healthy bone and joint pack. If you have any joint problems, I have to tell you, I'm 73 years old. I've been doing this for 64 years. I started when I was 9. I started taking, not the healthy bone and joint pack the way it is, but the 90 essential nutrients twice a day since I was 9 years old. Read the book, Dead Doctors Don't Lie. It tells you the story how I figured it out when I was 9. I figured I had a little help, right? No 9-year-old was going to figure it out then, so I must have had some help. But think about it. I haven't been sick one day in 64 years. People know me for a long time. I've never been sick in 64 years. I've never been on a prescription medication, never. I can still get another 8 hours of lecture on 1 foot if I can balance myself here. I mean, there's not many 73-year-old guys who can do that because they have arthritis and pain in their feet and their backs and all this kind of stuff. And so it has nothing to do with age. It has to do with everything. You're giving your body all the raw materials it needs to maintain itself. You put oil in your car, you change the oil every 3,000 miles, like the maintenance book says, that car will last 300,000 miles. You don't change the oil and you don't replace it as it's burning up, you might only go 50,000 miles, right? So, give me 90 days. If I fail, you can always get the surgery. If you go get the surgery first, you can't always get unsurgery, uninfected, unparalyzed, and undead. 4 years later, the same group of doctors, same database, looked at back surgery, low back pain, sciatica, restless leg syndrome, peripheral neuropathies, numbness, burning, tingling in your neck and feet and hands and so forth, degenerative disc disease, surgery unnecessary for sciatica and low back pain, low back problems. Give me 90 days. If I fail you with a healthy bone and joint pack, you can always, right? You can always go get the surgery. But you don't want to go get surgery first because of all the terrible things that they do to patients for back surgery. That's the worst. I see people all the time. They're all neuro. Oh yeah, they put 2 rods in my back 14 years ago and I'm doing fine now. Everything's good. Yeah, give me 90 days. Okay, diabetes is a simple mineral deficiency disease. It's not genetic in any way, shape, or form. We've known that for 70 years. It's a simple nutritional deficiency disease. But again, doctors are not obligated to cure you when there's a cure available. They're a protected monopoly. They can do what they want. And as long as you agree to it, everybody's happy. Why is there going to be a diabetes epidemic? 80 million baby boomers come along. Exercise, sweat out your nutrients, drink plenty of water. Don't take vitamins and minerals, you can overdose. I must hear that 1,000 times a day if I hear it once. I don't know who to strangle first, the patient or the doctor. And here's why you'll be burying your children. Wall Street Journal, April of this year. No easy cure for diabetic children. Now, we're not talking about type 1. This is type 2. It used to be called adult onset type 2 diabetes because it only occurred in people over the age of 50. Well, that was a long time ago. In 1963, people under the age of 5 never got type 2 diabetes. But look, following the doctors and the government's instructions, eat whole grains, don't eat fat, eat, plenty of exercise, don't supplement. Look what happened. See, if the doctors were right and the government was right, the chart should look like that again. Following their instructions, doing what they say, this is what you're getting. And so the kids are dying younger and younger and younger just from type 2 diabetes when nobody should get it. It's a simple mineral deficiency. High blood sugar is not the disease. High blood sugar is just a symptom of the disease. Just like elevated blood cholesterol is a symptom of type 2 diabetes, it has nothing to do with the cause of the disease, high blood sugar. Do not get statin drugs because they increase your risk of diabetes, type 2 diabetes, by 50%. And this came out, in 2012, right? Just like the other one I showed you. I don't get all the easy ones. When I get people with diabetes, I usually get them with complications. Here's some gangrene of the foot. I see gangrene of the legs all the way up to the groin. And a good endocrinologist, he loves this. I mean, the toes are crystallizing. There's not much healthy flesh left. So they'll cut the foot off right there at the arch. If it goes up the leg, they'll cut the leg off in the middle of the thigh or up at the groin. Well, with our program, it usually takes 2 to 14 days to wean them off their medication. Now they're an ex-diabetic in 2 to 14 days. It happens like all the time. The longest it ever takes is 30, 60 days. But I'd say 80% of them are 2 to 14 days. If they do exactly as I say, they'll wean off their medication because we're giving them the mineral that's missing. But what about the complications? What about blindness? What about heart disease? What about gangrene? Well, it just all goes away. Usually 30 to 60 days. We do have to have one thing for gangrene. It's called the Ultimate Daily Tablets, just like for vascular dementia and coronary artery disease. For this, I would also add, in addition to the Healthy Blood Sugar Pack, which is the Healthy Starter Pack, and the Sweeties, appropriate for body weight. If they have complications of the heart, or eyes, or brain, or complications of the gangrene, I give them the Ultimate Daily to get the circulation going. Here's another one that shows they don't know anything. Diabetes cases may double by 2050, and perhaps even triple. Now, what does that tell you about their level of knowledge when it comes to the cause of these? They don't know nothing. All they're doing is tracking numbers and treating the same way over and over and over. I remember Albert Einstein. He was a Nobel Prize winner, one of my favorites, and he said, many global things are unimpeachable. My favorite is, insanity is doing the same thing over and over and expecting a different result. He's the one that came up with that. What a beautiful global statement, right? And this just shows how stupid and insane they are. So again, the Healthy Blood Sugar Pack, and if they have complications, whatever is necessary to deal with the complications. Usually within 2 to 14 days, or an ex-diabetic. So if it's not cholesterol that plugs the arteries, what is it? It's inflammation caused the arteries by eating fried foods and eating oils and processed meats with nitrates and nitrites. All the things that turn into trans fatty acids, even at room temperature. You go to a restaurant, well, we're very careful to ask, we want salad, but we want it dry. We don't want any dressing on it. You know, when I go to a restaurant, I have all my eggs poached. At home, I'll soft scramble my eggs in butter because I know I'm using butter. If I ask the cook in an IHOP or a Denny's to scramble my eggs in butter, you know what they're going to do? They're going to use honey that tastes like butter because it's cheaper. And they think they're doing me a favor because it's, you know, it's an oil or a margarine. I want to be like George Francis. It'd be 112, at least. Okay? So the secret killer is not cholesterol. How many of you heard of the Saturday Evening Post? See, young people don't even know it. I thought it was a dead magazine. Ted, I didn't even know it still existed. This is a May-June 2012 issue cover article. Pill shocker, cholesterol meds may be useless. They left out two words. They should have said cholesterol meds may be useless and dangerous. Article's title was The Cholesterol Conundrum. One of the doctors interviewed for the information in that article said, everything you've heard about cholesterol and heart disease is wrong. Who told everybody that? Doctors. And then a summary of speaking to 12 different doctors. These authors of this article spoke to 12 different doctors who were primarily heads of the departments of cardiology at medical school, said, here's the summary, cholesterol levels are actually a fairly weak predictor of who will have a heart attack. What? What? Now this is just the opposite of what they said even 2 weeks before this article came out. Now I said this in '71 and they thought I was an idiot. Now they're saying what I said 41 years earlier. Okay? Cholesterol levels are actually a fairly weak predictor of who will have a heart attack, because that's true. Cholesterol has nothing to do with a heart attack. You saw this one earlier. Now this will mean something to you. Good cholesterol, not so beneficial. Higher HDL, high density lipoproteins, the good cholesterol levels don't reduce heart attacks. Lower your cholesterol of any kind, good or bad, doesn't reduce heart attacks because it doesn't cause it. You spent $1 trillion a year for 50 years for nothing. You spent all that money and all that energy and all that consideration eating stupidly, and you ranked 92nd in the world in healthfulness. 60th in longevity. That's what you got for following the doctor's instructions. All these illiterate people out there doing just the opposite of what doctors say, just because they're illiterate, live to be 112. Pediatricians want in on the largesse now. They want to get the kickbacks too, so they're going to start giving 8-year-olds statin drugs to lower their cholesterol, because they think if we lower the cholesterol levels in kids 8 years old, we'll prevent heart disease in adults. And what you're going to say is, no! Do not let them give your kids cholesterol-lowering drugs, because they will die before they're 20 and you'll be standing at a gravesite burying your children. And the last thing I'm going to share with you is my favorite article on cholesterol. We'll talk about high blood pressure and I'll be done. This is the last one on cholesterol, but it's my favorite article on cholesterol. Normal cholesterol in an 88-year-old man, let's call him Frank, who eats 25 eggs a day. Published in the New England Journal of Medicine. This is not a big study, this is a case report, but it's very valuable. This guy, Frank, goes in, 88 years old, for his annual physical, and Dr. Kern, who's a clinical doctor in the outpatient clinic at Harvard Medical School, which teaches, you know, young doctors how to be doctors, and that's scary. And Dr. Kern comes to Frank and says, look, you're in pretty good shape for 88 years old. Man, we couldn't find anything wrong with you. I'm going to reward you. I'm going to give you a prescription of Viagra. And so Frank stands up and kind of lifts up his belt, you know, and throws his shoulders back and says, well, I'm pretty good in that area. I don't need no Viagra. So the doctor says, really? What do you do? What do you do to be good in that area? He says, well, I eat 25 eggs a day. And the doctor says, what? The doctor's having a heart attack. What? You eat 25 eggs a day? So the doctor runs back into the lab and he reruns it himself. He couldn't believe the numbers. So he comes back and says, well, your blood cholesterol is 190 without medication. And why do you eat 25 eggs a day? He says, well, it makes me more studly. Now I want you to think about it. How many of you have heard of estrogen and progesterone? Okay, that's two steroid hormones. How many of you have heard of adrenal hormones? Okay, that's another steroid hormone. How many of you have heard of testosterone? It's another steroid hormone. Those 4 hormones are steroid hormones. And they're 95% by weight cholesterol. So you go on a cholesterol-restricted diet, you take cholesterol-lowering drugs, and there ain't nobody home anymore. Okay? You have erectile dysfunction. That's why they have so many ads on TV after 10 o'clock at night. There's Bob selling Enzyte. And the one I really love is Cialis. You know, this couple on the beach in the bathtubs. Now their genetic line is going to die out. They're very stupid. You got to be in the same bathtub before there's the right moment. I mean, 2 slabs of cast iron in between, there ain't nothing going to happen. No matter how good your erection is, right? Now, so, eat 6 to 8 eggs a day. And, you know, Ted's and his wife Nasima and Brandy, they always eat with me a lot on the road. When I go to these places, I'll have a big steak. If it's breakfast time, I'll have 4 eggs that are poached with a big hamburger patty or breakfast steak. And you can see all the people in the place are eating their organic multigrain waffles looking at me. And they don't even know it. They're dead men walking. So you take your 90 essential nutrients. We actually have an aphrodisiac called Drive. It's a little capsule, and the main ingredient is an herb in it. It's an Asian herb called Harney goatweed. It's a great little herb called Drive. We add that to our, I'll tell you a couple of other things, a lot of fun. Okay, the stealth killer, high blood pressure, is a simple mineral deficiency. High blood pressure is not genetic in any way, shape, or form. Even in the black community, it's not genetic. Millions don't manage blood pressure. Well, that's because they're treating symptoms. They're not dealing with the cause. Cause is a mineral deficiency. Salt has nothing to do with high blood pressure. What's the first thing a good farmer or rancher puts out for his livestock in the pasture? A salt block or salt lick, right? There's nobody out in that pasture telling a cow she's limited to 1 lick a day, is there? I refuse to believe my human patients are dumber than the cow. Oh, also, if you're biblically orientated, it's kind of fun. God said, go forth and be a salt of the earth, right? I mean, it's in the Bible. And God is forever. Now, doctors say restrict salt and they live to be 56. I'm going with God. Big study. Uh-oh, Houston, we have a problem here. Low sodium intake could be riskier. That's because sodium is an essential nutrient. You cannot have nerve impulses without sodium. You can't move water around in your body without sodium. You can't make stomach acid without chloride. Chloride and sodium are probably the most common of all the mineral cofactors necessary for enzymes and genes to work. Uh-oh, Houston, we have a problem. Now, while this study was designed to deal with high blood pressure in the black community, because doctors convinced the black community that high blood pressure is genetic in them, this also is true for whites and blacks and yellows and reds and oranges and everybody, right? What they did was go from Loyola University in Chicago and Oxford University in London to Nigeria. They wanted to go up in the mountains of Nigeria and find some tribal guys that had normal blood pressure. They could take their blood samples and they make a vaccine, come back, genetically engineered thing, inject it in every black man, woman, and child, and get rid of their high blood pressure that way. Well, they get out to Nigeria from Oxford University and Loyola University, and they find out that only 7% of the people living in the tribal areas of Nigeria have high blood pressure. 93% are normal. That freaked them out. So they go back to London, they go back to Chicago, and they start doing DNA tests looking for gene pools of people whose ancestors had originated from West Africa during the slave trading days in the 1600s, 1700s. They found lots of them. They started just simply screening by doing blood pressure. They found out that the people with the same genetic pool as from West Africa, as the West Africans, 33% high blood pressure. So you know immediately it's not genetic because your position on Earth doesn't dictate or change how a genetic disease will manifest itself. If you have a genetic disease here, you know, in Minneapolis, you're going to have it in London, you're going to have it in Cape Town, South Africa, you're going to have it in Auckland, New Zealand. It doesn't matter where you're on Earth, the genetic disease can be the same. So when there's a 5 times difference here between where you live, you know it's not genetic. Well, they didn't like that. So they gathered up more blood samples from Nigeria, more blood samples from all over the world, from people who had originated from Nigeria, their ancestors, during the slave trading days. And they got in the geneticists, and they got in the cardiologists, and the blood pressure people, and all this stuff, and they studied for 6 years. And in 2005, January 2005, they came out with the final results of the study. Remember, doctors want you to believe that it's genetic. This was published in the British Medical Journal, which is their version of the Journal of the American Medical Association, very well respected around the world. And here's what they said. Hold on to your hats. High blood pressure in blacks, not genetic. High blood pressure in white's not genetic. High blood pressure in yellow's not genetic. High blood pressure in red's not genetic. It's not genetic in anybody. It's a simple mineral deficiency disease. Now, how many of you in this room, particularly the black individuals in this room, how many of you had your doctor send you an email in 2005 saying, "Praise God, we just learned that high blood pressure in black's not genetic. You just take the Healthy Start Pack and the Ultimate Daily Tablets, blood pressure goes away in a couple of weeks. Hallelujah!" Anybody get that? I speak to black churches all the time. They've never heard of that. You know how many black men have died in the last 7 years because they didn't get the information? Over 100,000 from a high blood pressure stroke. Somebody needs to go to jail. But they won't because they're a protected monopoly. So how do we deal with this? We tell people ourselves. We share this information and get people to do things for themselves. They won't need doctors. And here comes the fun part. In August of 2003, in the Journal of the American Medical Association, of all things, JAMA, the Journal of the American Medical Association, in August of 2003, there was a big article in there about an herb that lowers blood pressure. It has flavonols in it. It's called dark chocolate. Not milk chocolate, not Hershey's bars, but dark chocolate has a substance in it called flavonols, which lowers blood pressure. Now, it doesn't solve the problem of the mineral deficiency, but it will act like a plant medicine. Herbs are plant medicines. It'll lower your blood pressure so you don't have a stroke until you're taking enough minerals for you to eliminate it permanently, right? But I just keep taking it because I like it. My blood pressure, I'm 73 years old. My blood pressure is 121 over 71. My pulse is 43. It does spike when I get angry. It'll spike up to 45 when I get angry. When I was wrestling for the University of Missouri, my wrestling pulse was 38, and the doctors were always freaking out, but I could always outrun them, outwhip them, and all this, that, and the other, right? And in addition, dark chocolate has another substance. It's a fun substance called PEAs, phenylethylamines. How many of you have heard of phenylethylamines? Okay, this is the reason why we give chocolate on Valentine's Day, is the phenylethylamines. Now, the Spanish, they didn't know the name of the chemical, but they knew there was something special about dark chocolate. So in 1523, they took it to Europe and started giving it away on Valentine's Day. The whole purpose of dark chocolate was to seduce the woman with dark chocolate. PEAs, phenylethylamines, are the love chemical. They're an aphrodisiac, right? It's really great stuff, but it's got to be dark chocolate. So, in that year, 2003, we came out with a product called Cocogevity. And Cocogevity has flavonols in it, will lower your blood pressure, but it's also loaded with PEAs. It always works, guys. So, when Valentine's comes up, and it's coming up in a couple of months, don't give chocolates, give Cocogevity and reap the awards. Reap the rewards. Okay. If you like pieces of chocolate rather than the liquids, I like the liquid. I add it to my coffee. We own a coffee company called Java Fit, and it made us publicly traded. One of the things we do, if you, I don't take anything from the company, even though I started the company. I don't take anything from it. I give it all back to you guys. You know, if you help other people, the more people you help, the bigger your check gets. This gets good. Okay. Anyway, triple treat chocolate. Triple treat chocolate. Triple treat chocolate. Why is it called triple treat? Because it lowers blood pressure. It has probiotics in it, which gives you good digestive stuff and gives you the best sex life you ever had. Triple treat, right? Because it has flavonols in it to lower blood pressure, but it also has PEAs in it, phenylethylamines. Good stuff. Now, two of these chocolates gives you 33,000 antioxidant points, 33,000 ORAC points, which is right in the halfway mark between 20,000 and 50,000 of these top 20 longevity people. Lower blood pressure, 33,000 ORAC points, and PEAs. I mean, how good does that get? And we also have another one called Triple Truffle. In addition, it has 500 milligrams of usable calcium per piece, which is the size of a pat of butter, and 1,000 international units of vitamin D3. So if you take 3 of those, you're getting 1,500 milligrams of usable calcium and 3,000 international units of vitamin D3, which is the minimum daily requirement for vitamin D3. Now, this is not a standalone product, obviously. You add that to the 90 essential nutrients and whatever else you got going. So that's sort of, and I could go on with, 894 other diseases. We don't have time for that, but you can read the book, Dead Doctors Don't Lie, Let's Play Doctor, and so on. I go through those diseases with you and tell you what to do for them. And so what I'm going to do now is turn this over to Brandy and Nasima and Ted, and they're going to give you some information, and you can flip on the lights now. All the lights can go up, and I will then answer questions for you for about, I don't know, half hour, 45 minutes, and we'll have a lot of fun and save a lot of people. Okay, thank you very much.